Good afternoon, everyone. My name is Endang Retno Surjaningrum. I'm from the Faculty of Psychology from Universitas Airlangga in Surabaya, Indonesia. In this occasion, I want to share my research protocol entitled Psychological Support to Pregnant and Breastfeeding Mothers for Posyandu Cadres during the COVID-19 pandemic, a research protocol of curriculum validation. It will be conducted by me, Endang Surjaningrum, together with my team, Achmad Chusairi, Reza, Lidia, Sari, and Bani Yudanagara. I will starting from explaining the community-based antenatal care in Indonesia. The antenatal care in Indonesia is usually conducted or provided by community health centers called Puskesmas, which is reside in every sub-district in Indonesia. This Puskesmas will also be assisted by community-based activities conducted in every villages, and is established by the head of village called Posyandu or Integrated Health Services. This Posyandu is usually provide maternal and child health care, and then it is conducted regularly, usually monthly. And in this Posyandu, the health center or the health officer will be assisted by a group of women, which is recruited by the village, and it's called Posyandu cadres or health cadres. This Posyandu is established in every neighborhood, and it provides services such as weighing the babies, provide immunization, monitoring the development of babies, and also monitor the pregnancy of pregnant women. Yeah. And you can see in this picture, the upper right is the situation in the Puskesmas, and then the middle one is the situation in the Posyandu, where health cadres or Posyandu cadres monitored by the health officer from Puskesmas will provide, for example, in this picture is vaccination or immunization, or sometimes they also provide vitamins B. Yeah, and also in this very low, we can see this is what we call a pregnancy class, which is a service provided to pregnant mothers to preparing their delivery process, and it is conducted by health cadres together with the health officers. During the pandemic situation right now, the level of anxiety among mothers increases, and basically pregnant and breastfeeding mothers are isolated similar to other community, and this situation would increase the risk for depression and anxiety among mothers. Unfortunately, at the same time, access to maternal health services are also limited or even stopped. Posyandu are also prohibited in some areas, especially also it happens in Surabaya, because the high rates of mortality are quite high because of this COVID-19 virus. So the Posyandu is prohibited, and then the health cadres have to take their role by visiting to the mother's home. Therefore, in this situation, we are thinking that health cadres or Posyandu cadres may also provide psychological support during their visits to mother's home, or also they can provide psychological support on online mode for the safer situation. However, these cadres needs to be prepared on providing psychological support because they never been trained in providing this kind of support. Yeah, and there are no training curriculum being prepared to the health cadres or the Posyandu cadres. Yeah, and the Posyandu cadres itself usually are high school leavers or finishing high school, middle high school, and therefore they need a specific training curriculum that fits to their level of education. So since the training has not been ready yet, we need to develop the training curriculum, and we need to also validate whether the curriculum fits to the cadres or not. Previous research said that online training on the management of perinatal depression had been conducted on health staff and resulted in an increase in their communication skills. And previously, there are research on the curriculum content of training on mental health detection of pregnant and breastfeeding mothers in Surabaya that has been carried out using a Delphi methods. Me and my team conducted this research, and results of this study will be used as a basis for developing the training curriculum for Posyandu cadres. So therefore, the aims of the study are: the first one is to explore the validity of training curriculum of psychological support for pregnant and breastfeeding mothers by Posyandu cadres. And the second one is to explore whether the psychological support training for pregnant and breastfeeding mothers for Posyandu cadres can effectively improve the knowledge and skills of cadres in providing psychological assistance for pregnant and breastfeeding mothers during the COVID-19 pandemic. We will conduct 3 stages of research using a quantitative approach. The first stage is evaluates the validity of training curriculum. The second stage is to evaluate the effectiveness of psychological support training for Posyandu cadres, while the third one is the community service, which focusing to train Posyandu cadres on psychological support. So the first stage, the validity steps, we will use a survey methods using 5 option Likert scale, and the participants of this the stage will be 30 people who are psychologists, which is academician and also practitioners in Puskesmas or psychologists in Puskesmas, midwiferys, cadres, and also village officers. They will rate curriculum modules, which consists of two types of module. The first one is psychological health on mothers during pregnancy and breastfeed. And the second module is the psychological support skills, preparing for the Posyandu cadres. The second stage would be training effectiveness. We will use experimental methods using pre-test, post-test control group design. And the participants of this stage would be 30 cadres from 2 villages, which is 15 cadres of village 1 will be assigned as experimental group, and the other 15 cadres of village 2 will be assigned as a control group. And as a treatment, they will be trained in the module 1 and module 2, provided module 1 and module 2, and on online mode through WhatsApp group, or we call it Kulwap. In Bahasa Indonesia, we call it Kuliah WhatsApp or WhatsApp lecturing group, and using Zoom webinars. The data will be analyzed using paired sample t-test. The third one is community services. We will use quasi-experiment using 1 group pretest post-test design. And the participants of this task actually is 15 cadres from village 2, the ones who were assigned as control group in the previous one or the previous task. And we'll also provide similar treatment also in the same mode using online and through WhatsApp group or Kulwap and Zoom webinars. And the data will be analyzed using independent sample t-test. So it is basically a community services, because this group of cadres who didn't get the training in the previous task, they will get the training in this task. But this data will be analyzed using comparing the pre-test and post-test design. So we expect results from this protocol or from this research are a valid training curriculum for Posyandu cadres and also an effective psychological support training curriculum for Posyandu cadres, which will be ready to be used in other areas or other villages in Surabaya. This is the end of my presentation, and thank you very much. If you have any question, we will discuss in the discussion session. Thank you.